Well, I was just going to say thanks very much for having me today, and it really feels that since I last attended this board meeting there have been some really substantial changes in the speaking up landscape in England. We've now got over 1,000 guardians, champions and ambassadors in every NHS trust and foundation trust, but also in quite a few of the arm's length bodies and independent sector providers and even a university, so we're extending our reach. We've had over 12,000 cases raised to guardians to date, and the vast majority around bullying and harassment and patient safety, so around 45% have got an element of bullying and harassment. And I think that fits very well with these NHS staff survey results, where a quarter of staff say that they've experienced bullying or harassment in the previous year. We've been providing training and development for guardians and for boards as well. And our survey that we recently did showed that guardians do have varied arrangements in the way that their job has been implemented. Over 40% don't have any protected time to do the work. And what we found from our survey is that the ones who don't have any protected time are less likely to be able to meet our expectations and certainly feel less able to meet the needs of their workforce. So they're less likely to have access to their chief exec, to present to the board in person, to attend training, to attend regional meetings, and probably most importantly, to seek feedback on their own performance from the people that they're supporting. So I'm really keen that organisations think very hard about what their guardian is able to do for them, and to take the lead from other organisations who've been increasing the amount of ring-fence time that they're giving to this important role, so that the guardians can actually do justice to the role. The other thing that we found from our survey was that when we looked at the experience and the perceptions of guardians, and we correlated that with the CQC ratings, it appears once again that the better organisations appear to have better speaking up cultures. And we asked a range of different questions. I don't know if you've already seen the annual report, but you can see that it goes that way, it goes that way, depending on what type of question we're answering, we're asking. So we'd really like organisations to think of speaking up as a way of improving the safety, the experience, and also the way that they're leading those organisations, because we believe that leadership is really key in this. I just wanted to mention the case review pilot. So we've been undertaking case reviews where we receive information that it appears that speaking up has not been well handled. And we found some really interesting things in our pilot, not only in terms of the structural elements such as policies. The standard NHSI policy has not been fully implemented, I would say, and we're seeing that as recommendations in multiple different organisations. So I do think there is something about a policy once it's sort of released into the system, how it's then checked to ensure that it is being implemented properly. But we've also identified areas of concern around the way that investigations are done, in the way that staff are responded to when they speak up, with elements of bullying and harassment, but also to do with ethnic differences and the way that the staff have been treated. So we've been identifying and systematically tackling these barriers to speaking up by making recommendations not only for those organisations, but for the expectation that all trusts will pick up on those recommendations and use them as ways to improve. Particularly interested in conflicts of interest, and we're doing a piece of work with NHS England around conflicts of interest policy implementation. In one of our case reviews, there were 9,000 staff in the trust and only one had signed a conflicts of interest declaration. I find that really surprising. And, for example, where I work, we do a regular declaration of potential conflicts of interest, because I think it really is important in terms of that transparency, but also how they're mitigated. We're doing a case review at the moment where settlement agreements play quite a large part, and we're following up on a piece of work with that, with the Department of Health and Social Care, with NHS employers and law firms, and we're really looking for your support in terms of how that then gets implemented into the wider system. And other special projects are forming an alliance with the Royal College of Surgeons of Edinburgh, with 20 organisations who are particularly interested in campaigns on bullying and harassment. And also our future priorities are in primary care, where we've got the funding from NHS England to extend across the whole of primary care, GPs, dentists, optom and pharmacy. to align our structure with your new regional structure, and also to look at phase 2 of our case review process so that we can offer more support to more people more quickly. So I suppose my ask of the board is really to get your feedback on what we've been doing, to thank you for the board guidance document, which I think has really helped to drive change, and also, as I said, about the settlement agreements, for you as an organisation with your own Freedom to Speak Up Guardians to continue role modelling best practice, but also to see how my organisation can help support any of your longer term goals as well.
Fantastic, thank you very much. Ruth, do you want to kick us off?
Thank you very much, Henrietta, and it's a delight. I can't believe it's a whole year since you were sat here presenting again. So I think it's got much more of a voice. It's much more uniform now when you go out to providers where people are talking about the Freedom to Speak Up Guardian and what they're doing and what they're not doing, or having access to protected time. The protected time for me is about how those organisations that have guardians with protective time, they're being much more proactive about it rather than just reacting to freedom to speak up. And I think that's a possibility that we might need to think here in NHSI. We've got a paper later on this morning around freedom to speak up within NHSI. So again, thank you very much for your leadership, and we continue to work with you. And of course Tom is also part of the team working for you.
One?
Thank you, very interesting report. I was particularly interested in the alliances you're building or the work with other organisations, and I'm wondering whether there's any scope to extend it to social care.
Well, that was sort of in the too difficult box even before I started. I think even when the Francis report was commissioned, actually, it was mooted and decided not to. But nevertheless, all organisations that have got a standard NHS contract, including nursing homes, including integrated care systems and GP practices and all sorts of other organisations, have a requirement to have a guardian. So we've actually been getting interest from organisations that maybe weren't considered as part of this, and we're reaching out in many different ways.
Well, to the extent that we can, I think, help with that, I think we should, because of course we know, social care is an important component of making us all work.
Yeah. There is a national whistleblowing helpline that's run by Department of Health, and that covers health and care. So I think there's something also about how that gets advertised and is well known to staff as well.
Richard?
I think one of the things we picked up at the NHS England board, so apologies for saying this again at 2 board meetings, but I think it's important, was this question of settlement agreements, where there was a perception, I think I got from you, that there was still a feeling that settlement agreements legally prevented, people felt they legally prevented them from speaking up. Now, that was something I thought we'd sort of put to bed years ago.
Yes.
But if there still is that perception, this is one of the things I think we can do as well, Ian, is quite explicitly, very explicitly say that actually in any settlement agreement, there's a little line at the front that says nothing in this prevents you from speaking up on matters of safety or whatever. And it's not difficult to do, so it's quite frustrating that you're still hearing from people
Yes.
that they feel this.
I think it's not only from the workers, but I think it's an expectation from the organisations that are asking people to sign them, that they also believe that it's sort of buying silence as well. So it's a huge piece of education, but also that's what we're looking to do with the law firms, is to put a really straightforward, plain English front page that makes it really clear what people can do, but also the NHS England standard contract wording is being changed. I think it needs to go into many different layers, including when law firms are taken on, the letter of engagement, the way that there's an expectation that people don't feel that they can sail extremely close to the wind on this, and just making it business as usual, that when people sign a settlement agreement, what they're signing away is their rights to go to an employment tribunal, and that's it.
Absolutely.
Kelsey?
Just a quick, so really good, and I think the way this has developed over quite a short time that you've actually been in post is fantastic. So there were just a couple of things really. One, I think the link to the outstanding trusts and the CQC inspections is what you would hope, but is really helpful to see. And I just think we could probably make that clearer in our discussions with organisations, that there is this sort of actual link in reality. And the second thing I was going to say is it feels really important that we have very open dialogue with you, as sometimes, you know, we talk to you about, we're worried about wherever, and you're able to give some insights and the other way around. So I think it feels as though we should maintain that really close, informal discussion as well, because sometimes I'll say to you, could you have a look at wherever it is, and you're able to give some insight. I think that's really helpful, that we're quite fluid between us as organisations.
I'd certainly say that we really value the support we get from NHS Improvement, because when we've done a case review, the action plan is owned by NHS Improvement working alongside the Trust, and we're not at the stage yet where we can say we've gone back after a year to make sure the actions have happened. But I think it's something about the message that this is not something, just because we found it in Trust A doesn't mean that it's probably happening everywhere else. So we've been thinking very carefully about how to ensure that the trust that we're looking at doesn't feel that they're slightly under the cosh, because actually the learning is applicable widely, and that would be a really helpful message for regional directors to be able to take out into the into the trust that they're dealing with. And I think that fits very much with the board guidance as an expectation that people will be drawing that learning from other organisations as well.
Aaron?
Yeah, I think this is great work. Absolutely delighted to hear that you've built the confidence in the system for people to report. I think for NHSI, I think we, as much as I love the CQC, I think we need to find a way of linking this to the quality and safety dashboards
Yes.
within NHSI.
Yes.
So we need more active data, live data that we can get in terms of feeding this, because the correlation you said is
So
well known
strong.
in the literature.
Yeah.
And that's an important. Could I just ask a second question? Why are you going to the Royal College of Surgeons in Edinburgh to talk to them? I'm sorry, we are in England here.
Well, I think what we found was that this is not an England problem. This is a
It's a
national
global problem, I know that, yeah.
It's a global problem. This is not just about doctors,
Yeah.
and that was one of the things about the alliance, which is very exciting, because we agreed two things: that it wasn't just going to be England, because we had the Scottish government there as well, and that it's not just about doctors.
Yeah.
And I think they say that if you can't fix everything that you call out, but until you call it out, you
Yeah.
can't
You
start
can't
to
fix
fix it. And so I seek allies wherever they are, and the RCS Ed has been running a fantastic campaign called Let's Remove It through their trainees, recognising that along with other surgical specialties, the trainees had had very poor experience, and so
Yep.
they were fixing it, and I wanted to be able to work with them
Sure.
to bring everyone else together.
Thank you. I think the reason you give is a very powerful one, which builds on to say, to address this issue, we need to engage with all the professional bodies in England or elsewhere, but in England to start off with, because the bullying and harassment is one of your professional values. You know, it's extremely important that if you get a fellowship of a said college, that you behave in the way that you've got that professional recognition of who you are as a clinician, whether a nurse, whether an allied healthcare professional, and I think we really need to engage those. It's not just you being able to operate or to nurse, it's about your, you know,
Being a good
this is about your
professional.
professional values working in a health system.
Yeah.
And we need to get the colleges to start talking about this to their fellows.
I think they are actually, and I think there's also something about support.
Yeah.
So it's about the environment that people are working in that drive those behaviours.
Yeah.
So really kind of pulling back the layers and saying, what can we do to create the environment in which people can flourish, and then their behaviours will follow.
Kate, you were looking to come in, and then David.
Yes, just to jump back to the settlement agreement point. The law is very clear, so I do share some of your frustration. I think the DH guidance is very clear. Any clause in a settlement agreement which seeks to compromise the right to make public interest disclosures is void. It just doesn't work. So I'm offering my services and my team to help you get that message even more clearly sent out to the service. Very happy
We
to
should
do
think
that.
about how we use all of the different communication levers that we have within NHSI as we establish the joint people directorate with NHS England and look to sort of codify best practice in HR. I think there's a lot we should be able to do to help you.
Absolutely. And the new Chief People Officer, I think, will
Absolutely.
be important in that, and
Yeah.
the rest of us can, I think, be very up for helping the service understand its obligations here.
Yeah. David,
So we had this conversation at the NHS England board, but I think it's, I'm going to repeat it only for my own sanity. I think that freedom to speak up needs to be matched by willingness to listen. And actually I think it builds on Ara's point, but I think there is a really important cultural and leadership dynamic to this, which we have to engage people with, because feedback is a gift that should be given and used. And actually, I wonder whether part of this is also about breaking down the barriers that actually says as much about creating that dialogue, but fundamentally about encouraging all of our people, starting with ourselves, to actually see this as an opportunity to engage and learn rather than something that's frightening. And I actually think there's quite a lot of evidence that's from other industries that suggests that you can create campaigning and broad-scale interventions that actually help people get comfortable with the fact that they should engage in this. It's not a threat, and that helps to give people the confidence to speak up. But unless you listen, it's a waste of time.
yeah, very well
So that's
said.
a sort of speech, really, rather than a question.
I think we all agree with that.
Absolutely.
It was really a question to, then I got a question to ourselves, which is in our toolkit that helps trusts in special measures, do we, given the very strong correlation between freedom to speak up and where you're rated in terms of quality, do we sort of try it the other way around, which is actually one of the things explicitly we help trusts with in special measures is how to build the speaking up culture. So we try and use it as part of the armoury of things to help. I mean,
Shall I?
yeah, maybe it's Kath.
Shall I start on that, Harriet?
Yeah, absolutely.
I mean, I think implicitly we do, and I think there's very often a cultural issue, and they embark on, change programs around culture and so on. But I do think we could do more on this. I think we could be more explicit around it. Very often, and Henrietta knows this, but very often when I go and visit trusts, for example, I want to see the Freedom to Speak Up Guardian, the Guardian for Safe Working, all of those sorts of things, because they're kind of in an alliance really within an organisation to help change the culture. But I think we could be more explicit about this, and we could really emphasise the need to reflect on this. And I think David's point about the listening, receiving, and making changes, because sometimes and the links in here with the staff survey and so on, very often the trusts that are in the most difficulty have the most awful staff engagement, and it all kind of is on a
and this would be
continuum
something that might
together.
help try and
think
change that dynamic.
I think we could do more here to
I'm sure.
actually use this as a lever for improvement.
So if I just give you a couple of examples, because I've been going and visiting lots of trusts and seeing, some tremendous practice and some what I've described as areas for development. If I just talk about visible leadership, so there are some trusts that I've been to where the execs make it very clear that there's not just a sort of nice to have, but it's an expectation that all of the execs will be out in every department every month, and they put it on the whiteboard and they tick it off when they've been, and if they haven't been, then everyone's asking the question. And on another trust visit, I was shown around by the Director of Nursing, who was introducing themselves to the staff as we entered the ward. And I thought to myself, why not go along half an hour before I arrived and just say, you've never met me before, but I'm your Director of Nursing, just make out that you know who I am. And it's almost like that lack of insight, which I thought was fascinating, but just told me everything I needed to know about that organisation. And so I do think there's something about what the expectation is of an exec, what their role is, who they're there for, and if you start building it from that, then that level of sort of their understanding of that they're there to serve the needs of their workforce and their patients and their public would go an awfully long way.
Absolutely great. Pat, you were looking to come in.
Thank you, David. First of all, excellent report. Thank you. I think, Henry, can you give us some sense of how we'll know if this is working? I mean, bullying harassment is a major problem for us. I mean, staff surveys repeatedly show it. If we look at comparable ratings from other healthcare systems, clearly we're out of field on it. So at the board level, is there a metric we can refer to that indicates that nationally, because this is what it's about, these behaviours are changing? And we can always cite one or two examples of things that have moved, but we have an interest in this is a national programme. Is there any sort of something you could offer?
So we're going to be looking at the elements of the staff survey that very much fit with this, and NHS England have commissioned a piece of work which will look at the trust that's made the most progress on this. So there are 6 questions in the staff survey that we're going to develop as a sort of index, which will give an idea of where people's position is and who's made the most progress. So I think that's a good way. You know, the thing about it is that staff surveys are often, you know, we're always a year out of date. Even the annual report is already out of date. And over a 2-year period, it's quite difficult to say we've seen this progress. But the things I would really point to are organisations that have had no speaking up cases. We're now down to 2. And I've spoken to the chairs of those organisations. We've had conversations about what might be the reason for that, and I think that they've got the insight into looking to make changes. There's a recognition that you know, high reporting cultures are probably good. I can't say what's a good number of cases per trust per quarter, but it's not 0, in other words. And then I would very much look at how trusts respond to speaking up from their staff, but also how they respond to complaints as well. So I have regular conversations with the Ombudsman, because it's about that feedback is a gift idea, that whatever's coming in should help to drive those improvements and be alert to that. So I'm very pleased in the response to Gosport that legislation is planned to ensure that all trusts have to report on their speaking up cases, the actions that they've taken as well. But I would also say it's about hearing from people who've spoken up. So over 2,000 people have given feedback, 87% said they would speak up again. To me, that's changes the paradigm.
That's great.
You know, and also from staff side chairs, they've told me that there have been Dignity at Work ambassadors around forever, and that hasn't really made a difference. The Freedom to Speak Up Guardian is reducing the amount of work that they're doing. So at the moment, it's, you know, little green shoots happening, but I'm hoping that we'll be able to get a broader picture from that.
Henrietta, it's so heartening to hear the progress that you and your team have made in the last 12 months. I think this was my first board meeting a year ago, and I've used your slide in a number of presentations and conferences, because the correlation is so clear that trusts that encourage staff to speak up, where if people feel safe to speak up, are outstanding, and trusts that don't are not. And it's so brilliant to hear the quality of the discussion now 12 months on. I hope you hear our passion and commitment to support you. I think we do recognise that we've got to take the plank out of our own eye as well, that there's quite a lot of work for us to do internally to genuinely role model this ourselves. We've got a conversation on that later on in our private session, but also working out how we structurally reinforce the cultural change that you're trying to embody in all of the interventions, all the touch points that we have, particularly now with our new leadership team joined together with NHS England. I think it's an opportunity to push it to the next level. And I think we've got to really challenge ourselves to say how are we using every lever possible to drive the culture change that is undoubtedly the golden thread that puts patients and staff at the centre of what we do. So thank you so much, and please don't be slow in telling us where you need extra support and assistance, because we really want to give it.
Lovely, thanks ever so much.
Okay. Thank you very much.